So let's do the GCS score very fast. So remember, there's eyes, verbal and motor components, and the score of total is 4, 5 and 6. So now the first rule is to do all the 4. So eyes may 4, V may 4 and M may 4. Now that means that when you're playing Uno, you have a draw 4. Okay, you have a draw 4. When you're putting it, you're going to be spontaneous. But when you're giving it to your opponent, the opponent is going to be confused. So draw 4. So 4 is when it comes to withdrawal reflex, like draw 4. Withdrawal reflex. Then spontaneous eyes are 4 matlab it's opening spontaneously. And confused because verbal response will be very confused. That is the first rule. The second rule is the rule of twos. So what all we are going to do twos now? E3, E2, E1, V3, V2, V1, M5, M4, M3, M2 and M1. So we anyways know that E1 means that there is no response, V1 means there is no response, and M1 means there is no response. So that all we are eliminating. Okay, no response, and no response. Coming to the second rule is rule of two. So 2 I's, 2 O's, that is we come to it, and 2 extend. Now 2 I's, you require 2 I's to give you pain. You require 2 O's. O's are all random sounds. So 2 is a random sound because TOO, 2. So it's a random sound. And 2 extend. So now I's, the 2 one is a response to pain, stimulus. Over here 2 stands for, it is a random sound. So they give you random sounds. And over here 2 is for abnormal extension. The third rule is the rule of cortex, flex, thrice. So here this is the abnormal flexion, and cortex because it is going to be decorticate. Remember, E for extension, E for decerebrate. Next is the rule of locals. So there are 5 locals. Okay, so remember 5 locals. So M5 stands for localizes pain. The last rule is a little tough. There are 3 verbs, rather past, present, and future. So remember, there are 3 types of verbs, and sometimes these verbs are very inappropriate. So 3 verbs, so that means E3 is basically response to verbal. Then they are sometimes inappropriate, so they give you inappropriate words. And that's about it. So now whatever is left, like B5 is left, it means that the person is normal. M6 is also the person is normal. So we are done with the GCS score.